Good evening, everybody. Good evening. In yesterday's classes, I think we have seen some basic points, and we also discussed the pathophysiology and clinical presentations of asthma. And in today's class, we'll try to start the pharmacology of anti-asthmatic drugs. And see, while discussing about the drugs, I'll let you know exactly how we have to study the drugs and what parameters we have to focus on related to the drugs, especially. Till now, I have not covered the drug related part. We have seen only therapeutics and pathophysiology. So, anyways, this pharmacology of anti-asthmatics is already there in second year. So, if I start pharmacology topics also, it will be better. It will be useful for second year students. Anyways, uh, when we start with the classification of anti-asthmatic drugs, see in the classification we have mainly we have five types. I mean, five classes of drugs. In that, the first class of anti-asthmatic drug is bronchodilator, which is very important. First class of drugs are bronchodilators. In asthma, what we have seen, patient will have inflammation, patient will have excess production of mucus, and patient will have bronchoconstriction. So due to these three reactions, due to these three physiological actions, patient's bronchial smooth muscles will be constricted and patient will be facing shortness of breath, right? Patient will be having difficulty to breathe. So in these conditions, we have anti-asthmatic drugs. They will be acting in different conditions. Like some drugs will decrease inflammation, some drugs will decrease mucus secretions, some drugs will directly cause bronchodilation. So symptomatically, some drugs will decrease the asthma symptoms, and some drugs will try to cure the condition. Permanently, we don't have uh, drugs to prevent the asthma. We don't have permanent treatment solution for asthma. It is not like an inflammation. It is not like infection. इन्फेक्शन एक बार आ गया, एंटीबायोटिक दे दो, बैक्टीरिया और वायरस और फंगस खत्म हो गया, उसके बाद disease was vanished. Not like that. Asthma, once it attacks to the patient, we have to keep managing the patient's condition. We have to treat the patient according to the patient's symptoms. So symptomatic treatment we have so far for asthma. We don't have permanent cure for asthma. Okay, this point you have to remember. So in anti-asthmatic drugs, first class of drugs we have bronchodilators. They will directly dilate the bronchioles. See, in asthma, patient was having bronchoconstriction, right? So due to bronchoconstriction, patient was having shortness of breath. So bronchodilators are acute drugs. I mean, these are emergency drugs which will dilate the bronchioles and which will decrease the shortness of breath. So bronchodilators are first line drugs in asthma. Anyways, about all these drugs I'll explain. In bronchodilators, we have sympthomimetics. Sympthomimetics are the drugs which will increase the action or mimic the actions of sympathetic system. In sympathetic system, we have adrenaline, noradrenaline. Okay, so that actually about the sympathetic system and parasympathetic system I have to start earlier, but after finishing asthma soon I'll start sympathetic system. Okay, sympathetic and parasympathetic system. So sympathomimetic drugs are those drugs which will mimic the actions of sympathetic system. In sympathomimetics, we have salbutamol, terbutaline. These two are short-acting drugs. We have bombuterol, salmeterol, and formoterol. Along with these drugs, we also have some other drugs. Here, bombuterol, salmeterol, and formoterol are long-acting drugs. Salbutamol is very important. Salbutamol and terbutaline. Salbutamol is short-acting drug. About all these drugs, I'll explain you. And second category of bronchodilators, we have methylxanthines. In that, we have theophylline, aminophylline, etophylline, and doxophylline. And along with these, few other methylxanthines also we have. And third category of bronchodilators, we have anticholinergics. Anticholinergics, they are not directly bronchodilating agents, but they'll try to decrease the secretions and also they'll cause bronchial smooth muscle relaxation. Through that, they are considered as bronchodilators. So in that, we have ipratropium bromide and tiotropium bromide. These are atropine derivatives, okay? Anticholinergics, atropine derivatives. Ipratropium bromide and tiotropium bromide are atropine drugs. And second class of drugs, we have leukotriene receptor antagonist. Actually, leukotriene receptors are those receptors which will be stimulated upon leukotrienes. When leukotriene falls on this receptor, what it does? It will increase the symptoms of asthma. That means it will cause bronchoconstriction, it will cause inflammation, it will cause allergic reactions, it will cause cough, it will cause wheezing. So when this receptor is antagonized, at that time what happens? All the symptoms of asthma, particularly the wheezing symptoms of asthma and the cough of the asthma will be decreased. This mechanism all I'll explain in upcoming slides. So in leukotriene receptor antagonist, we have zafirlukast, mintelukast, and Xylutine. These drugs are very important. In that, Mantelucast is very, very commonly used drug. Okay. And the third category is mast cell stabilizers. These drugs will try to stabilize the mast. In last class, what I told, when interleukins, when IL-5 stimulates, it activates the mast cells. And what mast cells does? Mast cells will release histamines and all other cytokines, and with that it causes bronchoconstriction. So when mast cell is stabilized or when mast cell is inhibited, what happens? The inflammatory mediators like histamines will not be released. So in that we have sodium chromoglycate. This is very important drug. Actually in hospitals we don't have that much importance, but their mechanism is important. And ketotifen is another drug. Okay, so these are three classes. And the next fourth class is very, very important. Fourth class of drug is glucocorticoids, or simply these are corticosteroids. Corticosteroids. About corticosteroids we didn't see in the last class. Okay, about the corticosteroids we will try to finish in this lecture. About corticosteroids I'll explain everything starting from short acting drugs, long acting drugs, and we have intermediate acting drugs, and also we also have inhalant, topical acting drugs. And in that we have inhalant glucocorticoids and we have systemic glucocorticoids. And the last category of drugs are anti-IgE. These are monoclonal antibodies. These are newer drugs now. Omalizumab is one drug. This is newer drug. This is very expensive, but in hospitals we don't commonly use this and all. Okay. So now we'll try to start with sympthomimetics. ध्यान से सुनो सब लोग. Actual topic यहाँ से शुरू होने वाली है. So this is just classification. In examinations they'll ask you classify anti-asthmatic drugs and explain in detail about sympthomimetics करके पूछते. Okay. In examinations they'll not ask everything. They will not ask everything. They'll ask the classification of anti-asthmatics, or in that, and along with classification they'll ask you to write about methylxanthines or about sympthomimetics or about anticholinergics. About one drug or one class they'll ask you to explain in detail. Anyways, we are not studying for marks purpose, we are studying for knowledge purpose, so we will discuss everything about each and every drug. So the first class of anti-asthmatic drug is sympthomimetics, right? So sympthomimetics, in sympthomimetics particularly we have selective beta-2 agonist. In sympthomimetics we have selective beta-2 agonist. In that we have two categories of drugs. Number one, they are short-acting beta-2 agonist and long-acting beta-2 agonist. In short-acting beta-2 agonist we have albuterol. Albuterol is also called salbutamol. Salbutamol, levosalbutamol, you might have heard in the hospital. Salbutamol is one drug, and we have terbutaline. Salbutamol and terbutaline are short-acting drugs. And in long-acting drugs we have bombitrol, solmetrol and formoterol. Formoterol is also very important drug. See, all these drugs we will study in pharmacology, but theoretically, practically when we go to the hospital, we will not find all these drugs. In hospital, most commonly used beta-2 agonist is salbutamol. Why we use only salbutamol? At the end of the lecture, you'll understand yourself. Okay. So in beta-2 agonist, we have two kinds of drugs. One is short-acting drugs and one is long-acting. Short-acting drugs are the drugs which will act up to 4 hours. Their duration of action will be up to 4 hours, and long-acting drugs will act up to 8 to 12 hours. Their duration of action will be up to 8 to 12 hours. This is the difference between these two. Okay. Now I will try to explain you about salbutamol in detail. In short-acting drugs we have salbutamol and terbutaline, right? Salbutamol and terbutaline. ध्यान से सुनो सब लोग. Already the 4th year, 5th year students and 3rd year students, you might have already studied these topics. And 2nd year exam bhi aap first internal you have already given. This is just a type of revision for you, and I'll give you some clarity. See, first important point I want to add here. In sympthomimetics, in beta-2 agonist drugs, first important point, these drugs will act on the beta-2 receptor. See, in beta receptors we have beta-1, beta-2, we have beta-2 and beta-3, right? We have beta-1, beta-2 and beta-3. I'll not explain about beta-1 and beta-3. We will focus mainly on beta-2 receptors, because we are discussing about beta-2 agonist. Beta-2 agonist drugs are those drugs which will stimulate beta-2 receptors, right? Beta-2 agonist drugs are those drugs which will stimulate beta-2 receptors. See, beta-1 receptor is present on heart, we all know. Beta-3 receptors are present on adipose tissue, we already know. Anyways, we will not discuss about this beta-1 and beta-3. Beta-2 receptors are present in lungs. They are present in lungs. Yes or no? They are present in lungs. In lungs particularly, they are present on the bronchial smooth muscles. Okay, this is one. They are located on skeletal muscles. They are located on all the cell membranes. They are located on the cell membranes, and few other places also they are located, but mainly beta 2 receptors are located in the bronchial smooth muscles, particularly in the lungs, and we need this action only. Particularly beta 2 receptors are present on lungs, and when beta 2 receptor is stimulated with salbutamol or terbutaline or bambuterol or solmetrol or formoterol, whatever the drug is, when they act on these beta 2 receptors, what happens, it will increase cyclic AMP in the bronchial smooth muscles. When beta 2 receptor is stimulated, it will increase cyclic AMP, and when cyclic AMP increases, it will cause relaxation of smooth muscles. It relaxes the smooth muscles of bronchioles. This is just bronchial tube. Just imagine this is a bronchial tube. Bronchial smooth muscles. In previous classes, I explained you. We have first layer, epithelial layer, okay, and we have connective tissue, and at the end we have smooth muscles, right? Smooth muscles, when smooth muscles are relaxed, the bronchioles will be dilated. Bronchioles will dilate. When bronchioles dilates, what happens? The lumen size increases, and it will decrease the symptoms of asthma, shortness of breath, वगैरह जो भी है, all the symptoms will be decreased. So this is the simple mechanism of beta 2 agonist. Clear this point? Beta 2 agonist क्या करते हैं? Beta 2 agonist will stimulate beta 2 receptors. Agonist means simple, they will increase the action of beta 2 receptors. When this receptor is activated, it increases cyclic AMP. Why sir cyclic AMP कैसा बढ़ जाता? ये सब चीज़ें सी. Actually, these beta receptors are G protein coupled receptors. About the G protein coupled receptors, I'll explain. That concept is very big. While explaining about that receptor, I'll explain. Okay. For now, just understand, when beta 2 receptor is stimulated, it will increase cyclic AMP and it relaxes the bronchial smooth muscles, and by that it decreases the symptoms of asthma. Simple. Clear? Now you see, mechanism we have seen. Now salbutamol is available in these many formulations. सब लोग ध्यान से सुनो, and very very important. Salbutamol is available in tablet form. Salbutamol is available in tablet form. It is available in inhaler form. Actually, this is metered drug inhaler. We call it MDI, metered drug inhaler. इसके बारे में I'll explain you. It is available in inhaler form. It is available as syrup. Salbutamol is available as syrup for the small children who can't take tablets or who can't use inhalers. Okay. Salbutamol is available as resipules. You know what is resipule? Resipule. How many of you know about resipule? Salbutamol is also available in resipule form. Actually, resipule form is the form. The solution is added to the inhalers. I mean nebulizer. These are called nebulizing solutions. Nebulizing solutions are called resipules. It is available as resipules. And salbutamol is also available in injection form. So whatever formulations we require, in all formulations, salbutamol is available. Salbutamol is available in tablet form. It is available in metered drug inhalant form. It is available in syrup form. It is available in resipules. It is also available in IV form. Okay, injection form. अब सब लोग ध्यान से सुनो यहाँ पे. Everybody should concentrate here. All the formulations, all the different dosage forms we have seen. One more point you have to remember: they are also available in Rota Cap. Rota Cap. They are also available in Rota Cap. How many of you know about Rota Cap? How many of you know about Rota Cap? In this Rota Cap is not there. I think I forgot to add that. Rota Cap. Salbutamol is also available in Rota Cap. Rota Cap is nothing but it is available in capsule form. Actually, just imagine this is a capsule. This is capsule, right? The salbutamol powder form is available in capsule form. Salbutamol is available in capsule form. This type of formulation is called Rota Cap. And this capsule, which is containing salbutamol powder form में रहता, capsule के अंदर powder form में रहता. This capsule is added into the inhaler. This type of capsules are called Rota Caps. We have Rota inhalers. इसके machine somewhere I added here. See, yes, it is already there. Yes, this is called Rota Fam. It is Rota Cap. We have 200 mcg Rota Caps. Salbutamol. See, this is a box. In this box, we have capsules. In this. These capsules are inserted in this machine. The capsule is inserted into this machine, and we have one button here. When we press the button, what happens? The capsule will be crushed. When capsule is crushed, what will happen? The powder form which is present in the capsule, that powder form is exposed, and that powder form is inhaled by the patient by placing this opener into the mouth. This is called Rota Cap machine or Rota Cap Inhaler. Understood everybody? This is Rota Cap Inhaler. Understood everybody? Are you all following me? This is called Rota Cap Inhaler. Rota Cap Inhaler. इसको कैसा यूज करते हैं? Whenever we go to hospital, I'll try to show you, or I'll make a video in the hospital itself. This is Rota Cap machine or Rota Cap Inhaler. We'll place the capsule somewhere here, and the capsule is crushed inside. When the capsule is crushed, what will happen? The powder form is exposed. The powder form is inhaled by the patient. This is very simple. So this is Rota Cap. यहाँ पे capsule इसके box के अंदर रहते हैं. Okay, and the Rota Cap capsules are very they are not very hard. The capsule is made in such a way that it can be crushed easily. Like that, in that form it is available. They are called Rota Caps. So first form, Rota Cap is the first form of formulation, and in Rota Cap we have 200 mcg capsules. Everybody understood this first form of salbutamol? Yes. And number two, salbutamol is also available in a metered drug inhaler. It is available in metered drug inhaler. Actually, the salbutamol is available in the form of solution. It is available in the form of solution. Aerosol bolte. That solution is kept into the pressurized machine, and this whenever the patient tries to inhale this whenever patient tries to inhale this, in single inhalation, only required amount of dose will come out. In one inhalation, only required amount of dose will come out. That is called metered drug inhalation form. Here it is. Metered, इसको क्या बोलते हैं? This form, metered drug inhalation form बोलते हैं. It is the Ventolin करके inhaler करके आता. See, you have to identify the different formulations and different techniques and different machines which are available for asthma patients in the hospitals. इसको क्या बोलते हैं? Metered drug inhaler बोलते हैं. And in metered drug inhaler, single time, when patient tries to inhale at single time, 100 mcg of drug will come out from the single inhaler. So if this metered drug inhaler is given, how many inhalations you will advise to the patient? 2 inhalations, because 200 mcg is single dose. We'll consider 200 mcg as single dose. Okay, and in children, single inhalation is enough. Okay, so this is the second form. And third form, we have salbutamol tablets. The image here itself. We have 2 mg, we have 4 mg, and we have 8 mg. 2 mg, 4 mg and 8 mg tablets are available. सब लोग ध्यान से सुनो. 8 mg tablets are available as sustained release form. And 2 mg and 4 mg tablets are not available in sustained release. 8 mg are available as sustained release. So 2, 4, 8 mg salbutamol tablets are available. इसके बारे में I'll discuss you in the form of kinetics. Why they are available in sustained release form. Okay. And what other form we have? Yes, we have syrup form. In syrup form, you see 2 mg. In syrup form, we have 2 mg per 5 ml, or 2 mg per 1 ml. 2 mg per ml. 2 mg per ml. Here I'll write here. 2 mg per ml syrups are available. 1 ml में 2 mg रहता. So how many milliliters of syrup you will give to the child? How many milliliters of drug you will give to the child? Yes. If we consider 4 mg as normal dose, so in that 2 ml can be given to the child as normal dose, or 1 ml with 1 ml, 2 ml, that depends. But syrup form में 2 mg per ml is available as syrup form. Okay, and I told you the recipe form. Okay, I told recipe form. In single recipe, actually 5 mg per 2.5 ml, 5 mg per 1 ml, 10 mg per 5 ml recipients are available. इसमें different formulations we have. We also have 5 mg per ml recipient. So in 1 ml recipient, how much drug we have? 5 mg. So if this recipient is containing 1 ml, if one recipient is containing 1 ml, so in that 1 ml it will contain 5 mg. Sometimes in 2.5 ml 5 mg will be there. So if this recipient is considered as 2.5 ml, so in 2.5 ml we have 5 mg of drug. So single solution recipient will be added with normal saline, and that normal saline will be used directly in the nebulizer form. You know how to use nebulizers, right? Nebulizers करके we have some nebulizing machines in hospital directly. So in that nebulizer machine, we will use this receptacle directly and we'll start the air. We will start the air or the steam. When steam is activated, the drug slowly it will form in the form of aerosol, and that aerosol will be inhaled by the patient. Nebulizer के बारे में भी if it is possible in hospitals, we'll try to make one video so that you'll understand in better way. Okay, so we have seen tablet form, we have seen metered drug inhalation form, we have seen syrup form, we have seen residual form, and now we also have in IV form. ध्यान से सुनो, IV form of salbutamol is very important. IV form of salbutamol is available in IM as well as in IV. It is not given in subcutaneous. Salbutamol is not given in subcutaneous form. It is given in IM as well as in IV. Okay, and when it is given in IV, it slow infusion should be given to the patient. IV में fast नहीं देना, slow infusion देना. It can be diluted or without dilution also. Salbutamol can be injected directly into the IV. Clear everybody about the dosage form? Clear everybody about the dosage form? अब देखो, I would like to add some important points here. See, salbutamol. In salbutamol we have short-acting in beta-2 agonist we have short-acting and long-acting. Salbutamol is short-acting drug, right? Whenever patient comes with severe shortness of breath, the first line drug that is available in hospital is salbutamol, and this salbutamol we have to start with inhalation form only. Why we have to start with inhalation form? Because we have so many other forms. Inhalation form में ही क्यों देना? When drug is given through inhalation form, immediately the drug will directly go and act in the lungs. Number one, locally action चाहिए अपने को. We require local action, right? So when it is given through inhalation route, immediately the drug will enter into the lungs. That is one. For showing immediate action, we will try to give in the inhalant form. And when it is given in inhalation form, याद रख लो, the action will start within 1 to 5 minutes. Action will start within 1 to 5 minutes. 1 minute के बाद तुरंत start action will be started to the patient. Onset of action is very quick when salbutamol is given through inhalation route. Of course, when it is given through IV route, the action also the onset of action is very quick. But when compared with the IV form and inhalation form is very safe and its onset of action is very quick. Because of that reason, we will prefer to go with inhalation form. Clear everybody? And one more point, when salbutamol is given through inhalation route, its duration of action is salbutamol is, first of all, it is short acting drug, and its duration of action will be up to 2 to 4 hours. Inhalation form its duration of action will be up to 2 hours only. Okay, 2 to 4 hours its action will be seen. And the normal dose we can give in inhalation form 100 to 200 mcg for every 6 hours we can give. I am not talking about IV, I am not talking about tablet form, I am talking about inhalation form. When salbutamol inhalation form is given, 100 to 200 mcg can be given for every 6 hours. हर 6 घंटे के बाद 100 to 200 mcg we can give. Why? Because its duration of action is 2 to 4 hours. Okay, for every 4 hours also we can give if patient is persisting with asthma symptoms. Okay, and whenever we require, we can go with metered dose inhalers. Just now I explained about metered dose inhaler. I think I pronounced it as metered drug inhaler. It is metered dose inhaler. Okay, why this MDI form is given? Because whenever action is termination is required, in that case this form is very effective. अब देखो, we are giving in tablet form. In tablet form, we can't immediately stop the action, right? So to terminate the action, we can go with metered dose inhaler. जितना dose चाहिए उतना ही ले सकते. If symptom is very high, we can take 3 to 4 inhalations. If symptom is very mild, we can take single inhalation. Okay. So for showing termination action or for decreasing the toxicity, metered dose inhalers are very effective. Of course, उसके cost of expensive. They are expensive in availability. They are available in expensive form. Okay. चलो. So this important point we have to remember. And see, when it is given through tablet form, याद रख लो सब लोग. First form, if salbutamol is given through tablet form, I just told they are available in 2 mg, 4 mg, and 8 mg tablets we have. When salbutamol tablet is given, 50% of salbutamol undergoes first pass metabolism. First pass metabolism. Do you know what is first pass metabolism? First year students, do you know about first pass metabolism? Yes, very good. See, when salbutamol tablet form is given, 50% of drug is metabolized in the first pass metabolism, and only 50% is entering into the systemic circulation. So because of this reason, do you prefer tablet form of salbutamol to the patient? Do you prefer tablet form of salbutamol to the patient? We generally don't prefer tablet form. Why? Because first reason, most of the drug is getting destroyed in the stomach as well as in the liver in the first pass metabolism. That is one reason. And second reason, tablet form of salbutamol may cause systemic side effects. That's why tablet form of salbutamol is not commonly preferred. अब देखो systemic side effects क्या है? What systemic side effects are possible with tablet form? Systemic side effects are seen with the IV form also. When salbutamol is given through tablet form and through IV form, other than inhalation form, if they are given through tablet form and IV form, it may cause some adverse effects. Can anyone tell me what adverse effects are possible with salbutamol? Anybody from the class? What side effects are possible with salbutamol? Anybody from the class? Unmute your mic and give the answer. If you know, you give the answer. Okay, listen. Hypersensitivity. Salbutamol causes hypersensitive reactions. Are you sure? Hypersensitive reactions are very, very rarely seen. I don't think salbutamol causes hypersensitive reactions. Anyways, देखो, hypersensitivity भी हो सकता है, but it is not common cause, a common adverse effect. First common adverse effect that can be seen with salbutamol, especially in tablet form and in IV form. So in inhalation form also it may cause systemic side effects. If salbutamol is given in extra doses and from the lungs, if salbutamol enters into the systemic circulation, even inhalation form also causes adverse effect. Now you see, the common adverse effects, the systemic adverse effects which are seen with salbutamol is, it may cause tremors. Why it causes tremors? Can anyone tell me why salbutamol causes tremors? Anybody from the class? Shivani, why salbutamol causes tremors? Yes, why salbutamol causes tremors? See, we have beta-2 receptors on skeletal muscles, right? When beta-2 receptors are stimulated, what happens? Skeletal muscle contraction होगा और tremors होने के chances है. Simple. It may cause tremors. These are systemic actions. Number 2, sometimes it may cause palpitations. And sometimes it will cause throat irritation. Throat irritation is not seen with the tablet as well as not with tablet and IV. Particularly throat irritation is seen with inhalation form. Throat irritation. Okay, it will cause throat irritation. And sometimes if systemic overdose of salbutamol, it may cause hypokalemia. Why will it cause hypokalemia? Anybody from the class? Why it may? Potassium will enter into the cells. पोटेशियम बढ़ता है या कम होता है? पोटेशियम फ्रॉम द एक्स्ट्रावास्कुलर टिश्यूज एंड इन द ब्लड, जो जहाँ पे भी ब्लड में है पोटेशियम, एंड इन द एक्स्ट्रा सेलुलर फ्लूइड, दैट पोटेशियम विल एंटर इनटू द सेल के अंदर चले गया तो क्या होगा? ब्लड के अंदर कम हो जाएगा ना. सो इट मे कॉज हाइपोकैलेमिया. सो these are common adverse effects, but these are not dangerous. For salbutamol, tremors, palpitations, throat irritation, hypokalemia danger हो सकता है, but it is very rarely seen. It is not seen. Systemic toxicity के time पे ही this can be seen. Okay, so these are some adverse effects which are seen with salbutamol. Now can anyone tell me what common drug interactions which are seen with salbutamol? Salbutamol के साथ drug interactions क्या हो सकते हैं? What drug interactions are possible with salbutamol? Anybody from the class? Drug interactions with salbutamol. we don't have major drug interactions. याद रख लो सब लोग. See, when salbutamol is given along with anticholinergic drugs, if salbutamol is given along with anticholinergic drugs, it will show synergistic action. It will show synergistic action. Number one drug interaction. Number two, if salbutamol is given along with methylxanthines, again it will also potentiate the action, and it will show benefit reactions. It will also show synergistic action. And one more point, if salbutamol is given along with tea or coffee, even that also improves the asthma condition. I mean, improves the symptoms. It will decrease the symptoms, or it will improve the efficacy of salbutamol. Salbutamol की action ज़्यादा होगी, synergistic actions. So, see, salbutamol is interacting with anticholinergic drug. Salbutamol is interacting with methylxanthines. When it is interacting with these two drugs, it is showing synergistic action, right? So the synergistic action is benefit reaction only. So salbutamol is sometime used along with, I think I didn't write that. Salbutamol is used along with, I don't think here I have mentioned. Salbutamol is used along with anticholinergic drugs like ipratropium bromide and tiotropium bromide. Okay, and it is also used along with methylxanthines. And sometimes salbutamol, ध्यान से सुनो, salbutamol also interacts with corticosteroids, and that with corticosteroids also it shows synergistic effect. So salbutamol can be given along with anticholinergic drug, salbutamol can be given along with methylxanthine, and salbutamol also can be given along with corticosteroids. When they are given along with these drugs, what will happen? Synergistic effect दिखेगी. That one point you have to remember. Clear everybody? Now you see, everybody should listen. Salbutamol, everywhere we have salbutamol only. Okay, चलो सब लोग salbutamol के बारे में समझ गए? Did you all understand about salbutamol? About salbutamol we have seen the mechanism of action. We have seen salbutamol different formulations, different dosage forms, and we have seen adverse effect of salbutamol, and we have also seen drug interactions of salbutamol. And now at the end, what is the use of salbutamol? Salbutamol का use क्या है बोलो? What is the use of salbutamol? Wherever patient is having bronchoconstriction, wherever patient is having bronchoconstriction, in all these bronchoconstriction conditions, salbutamol is drug of choice. Bronchoconstriction poisoning के टाइम पे हो सकता है, bronchoconstriction asthma में हो सकता है. It may, in asthma it can be seen, in COPD it can be seen. Bronchoconstriction can be seen in pneumonia, emphysema. Wherever bronchoconstriction is there, or wherever patient is facing with shortness of breath, or wherever patient is facing dyspnea, okay, wherever patient is having dyspnea, or wherever patient is facing chest congestion or chest tightness, in all those conditions, salbutamol is used to decrease the symptoms. Salbutamol के बारे में समझ गए सब लोग? Any doubt about salbutamol? Any doubt about salbutamol from the? Yes. Now you see. Now we will go with second drug, terbutaline. See, in the classification, salbutamol and terbutaline both are short acting. They are called short acting beta 2 agonists, right? यहाँ पे देखो सब लोग. In sympathomimetic agents, we have seen two classes. One is short acting drug, and the second one is long acting beta 2 agonist. In some therapeutic textbooks, you will find one term called SABA. You will find one term called SABA, SABA. What is SABA? Short acting beta 2 agonist. SABA means short acting beta 2 agonist. In SABA, what we have? In SABA, we have salbutamol and terbutaline. SABA के अंदर क्या है? We have salbutamol and terbutaline. And second long acting drugs, they are called LABA, LABA. While explaining about the treatment strategies, I will not explain about salbutamol, I will not explain about terbutaline. Simply I will tell we have to give SABA. If symptom is not treated, we'll go with LABA. Like that I'll tell. Once pharmacology is finished, we will, in treatment strategies, we will use all these short forms. Okay. So LABA means long acting beta 2 agonist. Okay. So in LABA, what we have? In LABA we have Bamitrol, Solmetrol, Formoterol. Even all these drugs, all these long acting drugs will also have same action like Salbutamol. Only difference is their duration of action is between 6 to 12 hours. Whereas SABA duration of action is 2 to 4 hours. बाकी के पूरे whatever actions we have seen about salbutamol, all the actions are also same with terbutaline and with LABA. Okay, clear? Now we will go with terbutaline. Terbutaline, whatever we have seen about salbutamol, same parameters are seen with terbutaline also. Terbutaline is short acting. Terbutaline shows beta 2 receptor stimulation activity. Terbutaline will act for 2 to 4 hours. Terbutaline has adverse effects same like salbutamol. So terbutaline is also available in residual form same like salbutamol. It is available as tablet form same like salbutamol. It is available as syrup form same like salbutamol. It is available as subcutaneous and IV. याद रख लो, terbutaline is available in subcutaneous form and in IV form, IV infusion form that also. It is not available in IM. Whereas salbutamol is available in IM. Terbutaline is not available in IM. Salbutamol is available in IM. याद रख लो this one difference. And you see, everybody should concentrate here. For salbutamol, we didn't see the other combinations. Okay, salbutamol के साथ दूसरे ज़्यादा combinations we have not seen. We are seeing with terbutaline only. Terbutaline is added with some other drugs. Why? Because terbutaline is compatible with other drugs, whereas salbutamol is not compatible with other drugs. That's why salbutamol ज़्यादातर दूसरे ड्रग के साथ नहीं देते. Whereas terbutaline is not interacting with other drugs. That's why it is mixed with other drugs, and it is available in combination form. याद रख लो this point. This is compatible drug, whereas salbutamol is not that much compatible. So terbutaline is available in residual form. It is available in tablet form. It is available in syrup form. It is available in parenteral form, especially subcutaneous and IV. And IV should be compulsory diluted before giving. Whereas salbutamol directly दे सकते, dilute भी कर सकते in IV slow. And terbutaline inhalant powder form में भी मिलता, same like Rota Cap, but this formulation is different. Inhalant powder form, in powder inhalant form it is available, terbutaline. This is another formulation. Now everybody should concentrate here. Everybody should listen to me. सुनो, ध्यान से सुनो सब लोग. Terbutaline is mixed with bromhexine. Can you see everybody in the image? Terbutaline is mixed with bromhexine, and it is also mixed with guanfacine. Have you heard about bromhexine and guanfacine drugs? Have you heard about these drugs? Second year students, सुनो सब लोग ध्यान से सुनो. Why terbutaline is added with these drugs, and why not salbutamol? Why not salbutamol is available with these combinations? I'll tell. See, first reason everybody knows, terbutaline is compatible with these drugs, right? And see, actually, terbutaline is a bronchodilator, right? Terbutaline is a bronchodilator. If anybody has severe cough, asthma में shortness of breath हो सकता है, and patient may have wheezing, patient also may have cough. If anybody has severe cough along with shortness of breath, see, for cough we have some drugs, some categories of drugs. In that, have you heard about antitussive agents? Antitussive बोलते, antitussive, SSIVE. What do you know about antitussive agents? Anybody from the class? Antitussive agents are those agents which will try to suppress the cough in the central nervous system in the brain. They will try to suppress the cough in the central nervous system. They are called antitussives. And in antitussives we have codeine, opioid drugs. Codeine is an opioid drug. We have codeine, and we have some antihistamines. In antihistamines we have phentermine malate, we have cetirizine, levocetirizine, hydroxyzine, all these drugs. Okay. So antitussives are the agents which will suppress the cough. So codeine and antihistamines are other examples of antitussives. This is one category of drug that can be added along with bronchodilators. अगर पेशेंट को ब्रांको कंस्ट्रिक्शन के साथ कॉफ है, if they are having cough along with broncho constriction, we can add antitussive agent number 1. And along with antitussive agents we also have some drugs called expectorants. सुनिए नाम expectorants. Expectorants क्या है? What are expectorants? Expectorants are also called mucokinetic agents. ध्यान से सुनो सब लोग. Mucokinetic agents. Mucokinetic means these drugs, what they do, expectorants will try to increase the secretions of mucus. Mucus secretion को बढ़ा देगा और उससे क्या होगा? By increasing the formation of mucus in the bronchioles, it will increase the movement of mucus. That's why they are called mucokinetic agents. It will increase the movement of mucus, and what it does, it will try to decrease the viscosity of mucus. Mucus का viscosity कम करने के लिए we can add expectorants. So expectorants are the drugs which will increase the mucus formation, and through that it will cause mucokinetic activity, and through that it will decrease the viscosity of sputum, and with that the movement of mucus increases, and it can be easily either swallowed from the pharynx or it can be expelled out from the trachea. Okay, so in expectorants what we have? In expectorants examples what we have? We have sodium citrate, we have potassium citrate. सुने नाम ये सब. We have guanfacine. Have you heard about guanfacine? Guanfacine is the example of expectorant. Just now we have seen, no, guanfacine. Guanfacine is the example of expectorant. Clear? आप समझ रहे आप सब लोग? Are you all following me? Yes, and see now along with bronchodilator we can add antitussive agent, we can also add expectorant, and along with this we have one more drug which is called mucolytic agent. Mucokinetic is different. Mucokinetic is expectorant, and we have mucolytic agent. Mucolytic means उसका meaning क्या है? Which will break down the mucus. Mucolytic agent is the agent which will break down the mucus, and by breaking the mucus, actually mucus जब solid form में है, this mucus will be totally broken down. When mucus is broken down, what will happen? The viscosity of mucus decreases. When viscosity decreases, what happens? Easily it can travel from one place to another place. Same like expectorant, but the action is different. Expectorant is increasing mucus synthesis, and mucolytic agent is breaking down the already solid form of mucus. And in mucolytic agents, what examples we have? We have bromhexine. We have acetylcysteine. Have you heard about acetylcysteine? Acetylcysteine is the antidote used for paracetamol poisoning. Acetylcysteine is a mucolytic agent, and we also have ambroxol. ये नाम सब सुने? Ambroxol, bromhexine, acetylcysteine or mucolytic agent. See here. I'm sorry. See, bromhexine is mucolytic agent, and guanfacine is mucokinetic agent, and terbutaline is bronchodilator. If any patient has severe shortness of breath or bronchoconstriction along with severe cough, we can go with this kind of formulation. What this formulation does? Terbutaline will dilate the bronchioles, and bromhexine will cause lysis of the mucus. It will act like mucolytic agent, and guanfacine will cause mucokinetic agent. Okay, so because of these three activity, it can be useful in asthma patient. Are you all following me? Yes. So about terbutaline actions are very, very similar like salbutamol. Remember, but terbutaline ke extra advantages what we have? Terbutaline is compatible with other drugs. So in syrup form as well as in tablet form, it is available with other combinations. Guanfacine or bromhexine, ambroxol ke sath rehta. Okay, it is available in IV form and also residual form. Clear? But mostly along with in SABA, mostly salbutamol is commonly used. That point you have to remember. Clear? Now the next category of drugs what we have in bronchodilators, we have methylxanthines. See, in category, in classification, first bronchodilators may number one is sympathomimetics. In sympathomimetics, what we have seen SABA and LABA. Actually, LABA may be same, actions are very same, but their duration of action is long. Duration of action is more. That's it. Baki ke pure, their formulations are also available in tablet form, they are available in IV form, they are available in inhalation form. They are mainly available in tablet forms. Yaad rakh lo. Inhalation, inhalation form and tablet form. Okay. Now we'll try to see about, where is my mouse? Now we'll try to see about methylxanthines. Very, very, very important drugs. The second bronchodilators, we have methylxanthines. सब लोग ध्यान से सुनो. See, in methylxanthines, particularly what we have theophylline, we have aminophylline, we have etophylline, and we have doxophylline. Theophylline is naturally occurring compound, and remaining aminophylline, etophylline, and doxophylline, these are synthetic form, semi-synthetic form. And the image we have here, caffeine, theophylline, and theobromine. These are naturally occurring methylxanthines. Caffeine is present in coffee seeds, and it is also present in tea leaves. Okay, it is also available in tea leaves. This caffeine, theophylline, and theobromine, these three compounds are present in coffee seeds, and they are also present in tea leaves. Coffee is Coffea arabica. Coffea arabica is the plant. In coffee seeds we have these three substances, and tea plant is Thea sinensis. In tea we have these three compounds. Clear? Caffeine का chemical structure क्या है? See, when we actually, this is a xanthine molecule. This is the xanthine molecule. This is xanthine molecule. This is first position, second, third, fourth, fifth, and 1, 2, 3, 4, 5, and I think this is sixth. 1, 2, 3, 4, 5, 6, 7. Yes, see, 1, 2, 3. This is 4. This is 5. This is 6, and this is 7. These are 7 positions. Okay. See, caffeine is on the first position we have one methyl group. On the third position we have one methyl group, and on the 7th position we have one methyl group. So caffeine scientific name क्या है? 1, 3, 7 trimethyl what? Trimethyl xanthine. It is a xanthine molecule, right? So the name of caffeine, scientific name of caffeine is 137 trimethyl xanthine. Clear? Caffeine का name क्या है? 137 trimethyl xanthine. And the second one is theophylline. Theophylline देखो, on the first position we have one methyl group here, and on the third position we have one methyl group. So theophylline scientific name क्या है? 1, 3 dimethyl xanthine. Clear? And this is theobromine. In theobromine what we have? On the third position we have one methyl group, and on the 7th position we have one methyl group. So 3, 7 dimethyl xanthine. These three compounds are naturally available xanthines. अपन रोज tea coffee पीते ना? In tea and coffee we have all these compounds. They are called methylxanthines. And along with these natural forms, we have aminophylline, we have etophylline, and we have doxophylline. These three are semi-synthetic forms. About those forms also I'll explain you. Their action and their duration of action is slightly different, and majorly all the other actions are very same. See, सब लोग ध्यान से सुनो. Methylxanthines are very, very important drugs in the hospital. Very, very important drugs in the hospital. Why? Because see, सबसे पहला, methylxanthines are narrow therapeutic drugs. What are narrow therapeutic drugs? Vicky, what are narrow therapeutic drugs? Yes, sir. What are narrow therapeutic drugs? The drugs whose therapeutic window is very narrow. In last class, I already explained. Second year wale, I think you already know what is narrow therapeutic window. Okay. See, methylxanthines. First, very, very important point. Methylxanthines are narrow therapeutic drugs. Clear? For narrow therapeutic drugs, they are having very narrow therapeutic safety. They may have Subtherapeutic activity, sometimes drug activity cannot be seen, and sometimes slight increase in the dose may cause lethal adverse drug reactions. That's why narrow therapeutic drug, when narrow therapeutic drug is given to the patient, we have to keenly monitor the patient's adverse drug reactions. वेरी वेरी इंपॉर्टेंट, इसके बारे में डिटेल में समझाता, देखो सुनो. फर्स्ट पॉइंट क्या है, मिथाइलक्सैंथिन्स और नैरो थेरेपेटिक ड्रग्स. क्लियर? नाउ यू सी, when methylxanthines are given to the patient, when methylxanthines are given to the patients, it will show actions on each and every tissue. I'll try to go very fast. See, number 1, on the central nervous system. What is the action of methylxanthines on central nervous system? On central nervous system, methylxanthines will cause CNS stimulation. It will cause CNS stimulation activity. Along with this, actually in normal doses, it will cause CNS stimulation. But if dose slightly increases, what it does, it will cause nervousness, it will cause restlessness, it will cause insomnia, and it will sometimes causes panic attack आ जाता है patient को. And if the dose is again if the dose increases, further dose increase हुआ तो क्या होगा? It will cause tremors. Very very important. It will cause tremors, it will cause delirium, and see, सब लोग ध्यान से सुनो, it will cause convulsions. Convulsions फिट्स आ जाते पेशेंट को. See, methylxanthines in normal doses they'll cause CNS stimulation. Slightly if dose increases, it will show all these actions, and if dose again further increases, it will cause convulsions, and further if dose increases, it will cause coma and death. Are you all listening to me? Methylxanthines are very very important. 1 टैबलेट 2 टैबलेट 3 टैबलेट दे सकते, अगर उससे ज़्यादा दे दिए ना, patient will develop all these signs and symptoms. Very 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 dangerous drug. These are the actions of methylxanthines on the central nervous system. Central nervous system के actions clear, everybody? Central nervous system actions clear. In this, one more point I want to add in the central nervous system. See, methylxanthines will directly stimulate chemotherapeutic zone. We have CTZ zone, right? It will stimulate CTZ zone, and it will cause severe vomiting. It will cause vomiting and nausea. So methylxanthines directly it will stimulate CTZ zone. Same like we have anti-neoplastic drugs, we have chemotherapeutic drugs. Same like chemotherapeutic drugs, methylxanthines will stimulate CTZ zone and it will cause vomiting. Clear? So these are all the actions of methylxanthines on the central nervous system. Now you see, on cardiovascular system, all these actions are very important. On cardiovascular system, methylxanthines will increase heart rate. It will increase heart rate, and it will increase the force of contraction of heart. Actually it will show same actions like adrenaline के जो भी actions heart के ऊपर होगा, it will show same actions, and through these actions what it does, it will increase blood pressure. याद रख लो, methylxanthines can aggravate blood pressure. Very very important. Clear? Especially by showing heart actions. But on blood vessels it will dilate blood vessels. So the summarized action, the ultimate action, blood pressure ज़्यादा नहीं हो सकता, but cardiovascular actions, cardiac stimulant actions we can see in the patient. Palpitation we can see increased heart rate, we can see increased force of contraction. Okay, now next action on the kidneys. What will be the action of methylxanthines on kidneys? On kidneys, methylxanthines will cause mild diuretic action. It will cause mild diuretic action. Are you all there? Are you all following me? Yes. And now next, on skeletal muscles, ध्यान से सुनो, this is bone, and on the bones we have skeletal muscles. What will be the action of methylxanthines on skeletal muscles? It will cause muscle contraction. Very important. And through this it will cause convulsions. Just now I told, it will cause convulsions. And in the stomach, methylxanthines will increase acid secretion. It will increase acid secretion. Okay, so it may aggravate peptic ulceration. In the stomach. And see, now everybody should concentrate. This point is very important. On metabolism, what methylxanthine does, methylxanthines will increase basic metabolic rate. Methylxanthines will increase basic metabolic rate. So चाय और कॉफी पीने से क्या होगा पेशेंट को बोलो? Tea and coffee, will they cause weight gain or weight loss? Tea and coffee, will they cause weight gain or weight loss? Weight loss, very good. Particularly fat, less fat containing tea and coffee. ग्रीन टी पिए तो फैट कम हो जाता, लीन हो जाते करके वी यूजुअली टेक ग्रीन टी, राइट? So in green tea also we have theophylline. In tea actually, in tea and coffee we have theophylline. So when we take tea and coffee, our basic metabolic rate increases, and what it does, it will decrease the patient's body weight. Okay, and the last action of methylxanthines is on the mast cells. On the mast cells, they will decrease the rupture of mast cells and they'll inhibit the release of histamines from the mast cells. मास्ट सेल्स के अंदर से हिस्टामाइन्स रिलीज कम कर देगा. सो दिस इज वन बेनिफिटरी एक्शन ऑफ मिथाइलक्सैंथिन्स इन द लंग्स. Clear everybody? These are different actions of methylxanthines on different tissues. Clear everybody? Clear everybody? Now you see. Now I'll go very fast. See, we have some drug adverse effects of methylxanthines. Methylxanthines के adverse effects क्या होंगे? Methylxanthines के adverse effects क्या होंगे? It may cause palpitation in the heart. In the heart, it may cause palpitation. Yes, and it may cause convulsions. It may cause convulsions. Nausea and vomiting. Nausea and vomiting is very simple adverse effect. It is very common adverse effect. Nausea, vomiting, and patient will have peptic ulceration. Patient will have peptic ulceration. ये सब adverse effect है. देखो, all these are adverse effects of the patient. All these are adverse effects of the patients. Are you all following? Now you see, we have some drug interactions. Methylxanthines के drug interactions we have to follow. See, 5th year students and PB second year students, you have to listen this point clearly, because in therapeutic drug monitoring you will study about methylxanthines. All these points will be repeated. When methylxanthine is given, we have to focus clearly. Why? Because they are narrotherapeutic drugs. In therapeutic drug monitoring we will focus only about narrotherapeutic drugs. So अब देखो यहाँ पे drug interactions क्या हो सकते हैं. We have two kinds of drugs. Number one, we have some drugs which are enzyme inducers. We have enzyme inducers, right? Methylxanthine के साथ अगर enzyme inducers दिए तो क्या होगा? Methylxanthine concentration will be decreased and it will show subtherapeutic effect. Yes or no? If methylxanthines are given along with enzyme inducers, methylxanthine will be metabolized very soon and their serum activity will be decreased and their activity is deteriorated. So in enzyme inducers, what we have? In enzyme inducers, what we have? I told you the synonym. I told you the mnemonic. What we have? crab GPS. इसमें क्या है? C, carbamazepine, rifampicin, alcohol, and phenytoin, graciofuscin, and sulfonylurea. So all these drugs, what they do? Along with these drugs, अगर methylxanthine दिए तो क्या होगा? Methylxanthine की activity कम हो जाएगी. Clear? That is one interaction. Number two, if methylxanthines are given along with enzyme inhibitors, if they are given along with enzyme inhibitors में क्या क्या है? Enzyme inhibitors में क्या क्या है? We have sickfaces.com. In sickfaces.com, what examples we have? Sodium valproate, isoniazid, cimetidine, ketoconazole, fluconazole, alcohol, and here chloramphenicol, erythromycin, and sulfonamide, and we have omeprazole and metronidazole. So all these drugs are enzyme inhibitors. अगर methylxanthine के साथ enzyme inhibitors दिए तो क्या होगा? Methylxanthine toxicity is seen, and all the adverse effects what we have seen just now, all these adverse effects are possible in patients with methylxanthines if they are given along any of these enzyme inhibitor. Clear? And now one more important drug interaction you should remember. If methylxanthine is given along with digoxin, digoxin activity will be increased. Digoxin is increasing force of contraction and it is increasing the cardiac output, right? Same like digoxin, methylxanthine also increasing force of contraction. So methylxanthine, this is the synergistic effect. Okay, this is the synergistic effect which can be seen with digoxin and methylxanthine. Clear everybody? These important drug interactions you have to remember about methylxanthines. Now you see what formulations we have for methylxanthines. Methylxanthines के formulations क्या है? Just now we have seen different examples. So methylxanthine directly theophylline tablets we have. Theophylline 300 mg tablets we have. Actually देखो सब लोग ध्यान से सुनो. Theophylline. Theophylline is naturally occurring alkaloid, right? Theophylline is naturally occurring form. Theophylline is naturally occurring, right? Yes or no? Theophylline is not water soluble. Theophylline is not water soluble. Theophylline actually it is a naturally occurring alkaloid. Theophylline is not water soluble. That's why theophylline is available in tablet form. Theophylline is available in tablet form. See, just now I told salbutamol. Salbutamol is bronchodilator and theophylline is also bronchodilator, right? When these two drugs are given along with combination, agar salbutamol 50 to 60%, if it is destroyed in the first pass metabolism, theophylline की action तो भी दिखेगी ना. So usually theophylline is usually combined with salbutamol. Clear? So theophylline is not water soluble and theophylline is not available in injection form. Theophylline is not available in injection form. It is available only in tablet form. Why? Because it is not water soluble. Clear everybody? Theophylline समझ गए सब लोग? Now you see for theophylline starting from 100 mg, we have 100 to 600 mg theophylline tablets. 100 to 600 mg theophylline tablets we have. Depends on tablet form, capsule form, and it is available in powder form. Mostly it is available in tablet form and sometimes it is available as capsule form also. Theophylline capsule form में भी मिलते. Okay? What is the dose? 100 mg to 600 mg. 100 mg is minimum dose and maximum is 600 mg. इससे ज़्यादा नहीं देना. Clear? This is about theophylline. And next we have aminophylline. Aminophylline, the difference between theophylline and aminophylline. सब लोग ध्यान से सुनो. Aminophylline is water soluble. This aminophylline is water soluble. It is water soluble. That's why aminophylline is available both in tablet form as well as in the IV form. Whereas theophylline is not available in IV form. Aminophylline is available in IV form. Clear? So aminophylline it can be given through subcutaneous route, it can be given through IM route, and it can be given slow IV also. Okay? And one more important point, aminophylline should be given in slow, very, very, very slow. It is given very slow IV infusion. IV infusion. Why you know? Aminophylline should be given in very slow IV infusion because aminophylline is very irritative drug. It is very irritating drug. It is very irritating drug. So when aminophylline is given through IM or through rapid IV formulation, IV bolus, it may cause severe irritation, it may cause phlebitis, and it may cause blood vessel related adverse effects. This thing you have to remember about aminophylline. Clear? And aminophylline dose क्या है? 100 mg we have, and here 250 mg per 10 ml. Depends from 100 mg to, this is also same, 100 mg to 600 mg. 100 mg is minimum dose and 600 mg is the maximum dose of aminophylline. Clear? And see one very important point, aminophylline should not be mixed with any of the agent. It should not be mixed with any drug. Very, very important point. Aminophylline should not be mixed with any of the form. Aminophylline should be given IV. Can aminophylline be given through IM route? Can we go with IM route? Can we go aminophylline with IM route? Aminophylline IM route से दे सकते हैं या नहीं? Yes or no? Why aminophylline is not given through IM? Very good. It is showing so much irritation. That's why aminophylline is not given. Subcutaneous भी नहीं देना. Better it is not suggested. Actually it is available. IM में, subcutaneous में, IV में है, but due to its irritation property, we will not suggest through IM and subcutaneous. It can be given through IV, but it is given in very slow IV form. Clear? This is second form of theophylline. And next we have etophylline and doxophylline. Etophylline is available along with theophylline. We have 300 mg tablets. Etophylline is another form of theophylline, and doxophylline is also another form. Here doxophylline is having combination with ambroxol. So these are different formulations of aminophylline, methylxanthines. Remaining concepts we will see in the next class ma. मेरे को अभी irritation is coming in my pharynx. Okay, we'll continue tomorrow. Remaining concepts, drug के बारे में जो भी we skipped, no, all those concepts will continue from tomorrow. Okay.